of incredible research and studies. They've been at top of their field in ozone and in other regards. In Ebola, they have essentially conquered giants. They've gotten so far to their pinnacle, and this is part of them being able to share that story while also making the public laugh. I'm gonna have to introduce them that way, mostly because they are a character. The three of them have a very distinct way of even introducing themselves, and so I'm gonna, I guess, pass the mic off to Marc.
Thank you very much. I know I'm going to butcher this story, but it goes something like this. Stephen King was asked to write a book about modern history. And he said, no, I can't do that. When I write my books, I have to make them believable. I want to thank Diana Lufty from Healing Science Policy and also Robert Kennedy Jr., a visionary whose career I have actively observed for the last 20 or 30 years. We live at a time of rapid change. I was born before television was an everyday phenomena and before commercial jet planes flew across the Atlantic. I'm here today as an open-minded scientist and college professor who has interviewed and written about these two incredibly amazing medical doctors, Dr. Robert Rowen and Dr. Howard Robins, both of whom have been ozone therapists since the late 1980s. What you will find if you pay close attention to them, that over the course of literally hundreds of millions of years of evolution, God or Mother Nature has given humans a tool to enhance what our own immune system is already doing, the emergence of microscopic, mindless fragments of RNA that, as we have seen with COVID pandemic, can literally kill and completely shut down our entire society. In 2013, Dr. Rowen, who by the way is a Phi Beta Kappa graduate from Johns Hopkins University with a medical degree from the University of California, San Francisco, put all the pieces of the puzzle together to realize that all viruses have what he calls an Achilles heel. It is their lipid envelopes, their outer skin. Ozone, which is simply 3 molecules of oxygen instead of 2, is a powerful disinfectant. It is used in sewage treatment plants, Las Vegas casinos, hospital rooms, Olympic swimming pools, and was used by France to clean up the Seine River. The way it works is that ozone therapy causes a tear in the lipid envelope of all viruses. Since viruses have no means for self-repair, if their lipid envelope is torn, the virus dies. Having figured this out, when Ebola erupted in West Africa, Dr. Rowen called upon his friend and colleague, Dr. Howard Robins, because he wanted to use Dr. Robins' technique of direct intravenous into the bloodstream of 97% pure oxygen and 3% ozone. Because Ebola was so contagious, because it has a 60% death rate, it was important to minimize the equipment. So basically all that would be needed would be a needle and some tubing, which can be thrown away. Dr. Rowen was concerned that Ebola could jump continents. His goal was to save America, to save the homeland. We didn't know how contagious Ebola was. Howard, he said, I'd like you to come to Africa with me, where Ebola's broken out, to train medical personnel how to cure Ebola virus. Howard couldn't believe it. You out of your friggin' mind, he said. And he didn't use the word friggin'. And he hung up the phone. However, before the phone clicked, well, Howard, I'm going to go anyway, and I'm going to use your method. He then looked at his watch, and he waited about 20 seconds, and the phone rang, and Dr. Robins called him back. And he said, the hell with you, Rowen. I'm not going to let you get all the credit. I'm going to be able to stop this pandemic with my technique. Like it or not, I'm coming with you. So these two guys, on their own dime, and with $40,000 of equipment from colleagues and from ozone-generated companies, went to Sierra Leone to learn how to teach medical personnel ozone therapy. Although their project was suddenly obstructed, apparently by corrupt pharma, they did manage to disable the virus in 5 infected patients. Now, again, this is a virus that has a 60% death rate. 4 were medical personnel, and 1 was a girlfriend of an infected doctor. She had to jump over a fence to get healed because Leone had all of a sudden made it illegal. But all these 5 people that were treated with this treatment were cured. This is a very important history in the making finding. In my humble opinion, I think that Dr. Rowen and Dr. Robins should be nominated for a Nobel Prize. I think that they risked their lives to go to a faraway place to deal with a very contagious disease. And they were able to establish that this disease could be disabled through ozone therapy. The reason that ozone therapy is the black sheep of the family can be reduced down to a single sentence. Federal Regulation Title 21, FDA, which says that ozone is a toxic gas with no medical application. This simple sentence has no basis in fact. This sentence has caused mainstream doctors, government officials, and every reporter you can think of to back off from giving any serious consideration to the study of this incredibly important safe medical procedure. What happens is their lawyers will read that sentence, ozone's a toxic gas with no medical application, and the lawyers will say, don't touch it with a 10-foot pole. The government will do that, the reporters will do that, and the hospitals will do that. We were trying to get clinical studies done in the hospitals. These 2 gentlemen and their colleagues would have been able to disable the COVID virus in a matter of 2 or 3 weeks at the most in the ICUs, and we were unable to do so because the hospitals would read Title 21. So I'd like to end my introduction with just 3 suggestions. The first suggestion is I want Robert Kennedy to look at this information that Dr. Rowen can provide, and also 4,900 articles in PubMed, all basically saying over 50 years of research that ozone therapy is a safe germicidal. The second point is I think that Congress needs to bring medical professionals such as Dr. Rowen and Dr. Robins before Congress and all the other ozone therapists that we know, there are about 500 or more in the country, to testify that there's nothing wrong with ozone therapy. It's a perfectly safe medical procedure. And the third point I want to make is that hospitals should allow clinical studies to be done. There are now over 1,000 people a week still dying from COVID. Keep in mind that the talk you're about to hear is not based on theory or speculation. It's based on over 30 years apiece from each of these 2 gentlemen. I am honored to introduce to you 2 of the bravest individuals I know, 2 medical doctors who have literally put their lives on the line to protect humanity from emerging viruses, doctors who have spent their entire professional career successfully treating literally tens of thousands of patients with a proven safe germicidal procedure that is well over 100 years old. I give you Dr. Robert Rowen and Dr. Howard Robins.
And I had to coerce you to make the trip.
I am greatly honored to have been able to introduce these 2 guys.
Thank you. We are really honored. That was a very, very kind and an almost embarrassing introduction.
You guys,
thank you. All right, I've got to try to get out of there, so I'm going to move forward. If there's people in the public who want to hear a miracle of health and medicine, and they're in this park, you ought to come, because you're going to hear stuff that's true, proven, and absolutely mind-blowing. And it's a sin and a disgrace to this country that it's not out there. This is the story of ozone therapy, and it's the story of the near universal panacea that's out there today that all of us could have for just about anything, any affliction that we have. It's not just a germicidal, as you will see. My medical life since 1986. I started with ozone in 86 in Alaska. With the first patient, it changed my life and I became an oxygen therapy. Oxygen consumption is the source of all life and all healing. You burn more oxygen, you'll heal. You burn more oxygen, you'll stay healthier and live longer. This is my quote. With the exception of diet, nutrition, and detoxification, ozone therapy has done more for more medical conditions than everything I have ever seen in conventional medicine combined. The information here is supported by hard science and experience. You might not know it, but your own body makes ozone. Antibodies that your body makes generates ozone in your body. This was at the Scripps Institute, major medical center, published in 2003. Ozone can kill invading microorganisms and augment and moderate the inflammatory response. This was at Scripps. Next. Ozone is 3 atoms of oxygen. That's it. We're breathing O2. But the third atom of oxygen makes it highly reactive, and it's the strongest naturally occurring oxidant. It's made, you can smell it after a lightning storm. It smells fresh. The air is cleansed by the ozone. The World Health Organization has told us that we are on the cusp of a post-antibiotic era. This is extremely serious. The CDC, the Corruption Deception Commission, says that there are 2.8 million superbug infections in this country and 35,000 deaths annually. Next. This, you're going to see Cuban research and where they did ozone ahead of an insult. In this slide, animals, rats, were given ozone therapy first. Then they were injected with a lethal amount of stool contamination. Just with ozone, 60+% of the animals lived. If they were given that injection of ozone, or actually rectal ozone or intraperitoneal ozone, 24 to 72 hours. Just ozone ahead of the insult. Next. Now, people are dying in the hospital, even with antibiotics. Here you see 72% to the left of that red, 72% of patients or animals lived with just an antibiotic. If you added ozone to it, over 90% lived. I'm not against current drugs. I'm not against the pharmaceutical industry. You just got to use them appropriately and maybe combine it with things like this. As good as ozone is an antimicrobial, it's also an anti-inflammatory. And you heard a lot already about inflammation. Inflammation destroys, inflammation reduces circulation, it's aging, and it destroys us. This is a slide where animals were given ozone therapy to look at the response of the production of something called TNF alpha, tumor necrosis factor alpha.